طيب ماشي ماشي، شكرا حسام، شكرا. اهلين. الله يمسيكم بالخير. سامعيننا؟
مسموع دكتور.
حسام سمعنا.
دكتور صوتك مسموع بلا.
طيب الاوديو كويس، الصوت كويس ولا علي صوتي شوي؟
لا عادي دكتور، كثير بيرفكت.
طيب كويس. هو في تو توبكس اليوم، واحدة منهم فيرال هيباتيتس، واحدة منهم inflammatory bowel diseases. Hopefully they're not gonna take more than 30 minutes each يعني. I'm gonna يعني scroll يعني fast forward شوية. So as far as viral hepatitis خلينا بس شوفوا يعني
بدي اخلص بكير.
احنا في background noise هنا شوية. We would like to outline the epidemiology of viral hepatitis in the next 30 minutes, recognize the clinical features of both acute and chronic viral hepatitis. We'll also touch on laboratory abnormalities and most common in these diseases. And then we talk about the complications of chronic viral hepatitis, and most importantly, how to interpret the serological tests to get these problems diagnosed. And then a little talk about the treatment therapy available for chronic hepatitis. And last but not least, candidates for vaccination. Tamam? This is a historical perspective. There used to be something called non-A, non-B viral hepatitis. They turned out to be either C or E. And traditionally, A will E, they are both enterically transmitted, يعني fecal, orofecal route, while the B, D, and C, they are parenterally or sexually transmitted. So these are the types of hepatitis, and they are only the hepatotropic viruses, يعني those viruses with a specific predilection to infect the liver. ولا هو otherwise في other viruses طبعا، يعني like CMV, Epstein-Barr virus, EBV, even rhinovirus, adenovirus, كلهم can infect the liver, بس هذول specifically they target the liver. A, B, C, D, and E. Just from this slide, remember in A and E, they never become chronic, okay? While B, C, and D, in different proportions, they can go on to develop, chronicity. Hello, شو clinical manifestations? I'll give you a mnemonic from A to C, يعني A, B, C. A is the most symptomatic, and C is the least symptomatic as far when it, يعني, regard to acute infection. Pregnant women most commonly suffer from hepatitis E virus infection with mortality up to 30%. As I said, acute HCV is the least symptomatic. The symptoms are non-specific. They could be just a fever, arthritis, يعني it could look like any flu infection. تمام? Symptoms resolve, improve after the jaundice appears. Again, في إشي اسمه viral syndrome that could be the only presentation for acute viral hepatitis. What about the laboratory test? Well, the most important, the hallmark and most important thing in acute viral hepatitis is elevation of the liver enzymes, AST or ALT, along with elevation of bilirubin, most commonly in hepatitis A or least commonly in hepatitis C. But it's not only viruses that can elevate the hepatic viruses, but drugs, ischemia, other viruses as well, toxins. In modest elevations, less than 10-fold increase, while upper limit of normal is 30, in up to 300 can be seen also in other diseases like metastatic livers, infiltrative diseases to the liver, biliary obstruction, alcohol when consumed in large amounts. Remember, in bilirubin and alk-phos may or may not be elevated, and here we talk about cholestatic or non-cholestatic acute viral hepatitis. While the white blood count typically goes down, so we have leukopenia rather than leukocytosis as in the case of bacterial infections. Okay. Now, that was the manifestations and the laboratory test of acute viral hepatitis. What about manifestations or stigmata of chronic liver disease? We're going to see pictures of these اللي أمامكم أنتم شايفينهم: spider angiomas, palmar erythema, finger clubbing, Dupuytren contracture, gynecomastia, testicular atrophy. This is what we call angiodysplasia, okay? And this is a close-up view. It's a slightly raised, ramified, present only the upper torso anteriorly and posteriorly because it's related to the circulation of the superior vena cava. This is the palmar erythema thing, but it's not pathognomonic or characteristic of acute viral hepatitis or chronic viral hepatitis, as this can be seen in normal people, in pregnant women, people with thyrotoxicosis or in corticosteroid therapy. So remember this, it's not specific for chronic hepatitis. This is the so-called Dupuytren contracture, which means that individuals cannot fully extend their fingers. It's a flexion deformity. Clubbing of fingers. Okay, so now we're gonna tackle the viral hepatitis one by one, starting with alphabetical order, اللي هو hepatitis A. Incubation period is in the order of few weeks. Don't memorize these numbers, يعني. Jaundice, as patients are older, they're more likely to get symptoms because of their immune system being more mature, meaning that little kids, 3-4 years of age, they are less likely to develop the disease acutely. Okay, the complications, well, 1 in 1,000 can die because of acute liver failure. There is something called the prolonged cholestasis, which means that people stay yellow jaundice for up to 6 weeks, but there's nothing bad with that. It resolves ultimately. No chronicity with acute hepatitis A, as I said. This is the typical serological profile. The ALT goes up, the virus is shedded in the feces, the patient has symptoms, and then the patient in the first days develop the IgM, which is the primary immune response, anti-hepatitis A virus. So this is the serological test used to diagnose acute hepatitis A. And then people, they go on to develop later on IgG, anti-hepatitis A virus, which is the hallmark of remote infection. The transmission, as I said, is orofecal. Okay, this is the epidemiological picture. As you can see, third world countries where there's poorer standards of hygiene have higher incidence of acute hepatitis A. Serologic diagnosis, I said that already, okay? And the vaccination should be reserved for these categories of patients. يعني highest attacks لأنه بال5 to 14 years old. Travelers to endemic areas 2-3 weeks prior to their scheduled travel, they should get vaccinated. Homosexual men, injecting drug users. The prevention is by means of طبعا immunoglobulins and vaccines if there is exposure, so that you can get the patient to have some antibodies before the immune system starts to work. So that was acute hepatitis A. What about acute hepatitis B? Incubation period is a little bit longer. Clinical illness, same, acute hepatitis B as for acute hepatitis A. The younger patients are, the less likely they have symptoms. The chronicity is the exact opposite. The younger they are, the more likely to become chronic, up to 90% in children, infants born to hepatitis B surface antigen positive mothers. Okay, so this is the virus, is very strong, very resistant, and as a matter of fact, we need to we need to take more precautions when we are dealing, like in the endoscopy unit. I myself take more precautions when I'm dealing with a hepatitis B surface antigen positive patient than HIV or HCV. So it is a very prevalent infection. More than 1/3 of the globe has had it, and 1/5 of these they stayed hepatitis B surface antigen positive. 40 million are in our region of the Eastern Mediterranean. And there is some chronicity, and the important thing is the hepatitis B is carcinogenic. It's behind a big proportion of the so-called hepatocellular carcinoma. And the last thing here, that it's 100 times more contagious than HIV. And that's why we recommend for strict precautions when dealing with hepatitis B virus infection. So it's an important infection. It's number 7 among deaths from infectious diseases following these. The consequences of HBV acquisition: acutely, it can lead to death in 1 in 800, 1,000 patients. Chronically, patients might go on to develop chronic liver disease, progressing to cirrhosis, liver failure, and possibly developing hepatocellular carcinoma because of the carcinogenic potential of the virus. And then we have the so-called extrahepatic manifestations, manifestations outside the liver. This slide summarizes possible outcomes in chronic hepatitis B infection. So if the patient is simply a carrier, he has the surface antigen, but the E antigen is negative, the enzymes are normal, and the viral load, the HBV DNA, is low or 0. While if they are chronically infected, whether they are E antigen positive or negative, they have elevated enzymes and elevated HBV DNA. In the middle, between the carrier and the chronic, there is something called immune tolerant, which is the case of a patient with hepatitis B surface antigen positive, normal enzymes, persistently normal, and very high HBV DNA. And that means that the virus and the person are tolerating each other. Extrahepatic manifestations: acutely, arthralgias and papular acrodermatitis, the so-called Gianotti-Crosty syndrome. Chronically, all the itis like nephritis, arthritis, and arteritis, polyarteritis nodosa, which is a medium vessel vasculitis. This is the Gianotti-Crosty syndrome, papular dermatitis. And these ugly lesions are a medium vessel vasculitis secondary to hepatitis B virus infection. The serology. All right, the hallmark of the infection is the surface antigen, which can go on, if the patient recovers, to become or convert to anti-hepatitis B surface antigen antibodies, and the patient remains immune for life. This is important. We diagnose acute hepatitis B by checking this IgM anti-hepatitis B core. So if you are asked on MCQs or an exam, how you diagnose acute hepatitis B, the answer is IgM anti-hepatitis B core. What if the patient becomes chronic? Well, first of all, the surface antigen stayed there. There is no surface antibodies. And of course, you develop the IgG anti-hepatitis B core. This slide summarizes what we said regarding acute infections. Symptomatic infections, they are more prevalent or more common in the older people. Chronicity is more common as the patients are younger. This is important. This tells you that in our region of the world, most of the hepatitis B are horizontal between toddlers or perinatal from mother to child, while in Western countries, it's mostly percutaneous, like drug abuse, IV drug abuse, or sexual. And this here, the scenario in Jordan, hepatitis B is more common than hepatitis C. It's up to, it used to be 8%. It's much lower now because of the vaccinations and the prophylactic measures. It's in the range of 3 to 4%. Okay, remember that all biological fluids are potentially capable of transmitting the virus. Blood, serum, semen, saliva, just about all biological fluids. This we said already, sexual or perinatal or parenteral. To summarize, the initial evaluation of hepatitis B surface antigen, and that's what I get in my clinic. A patient who went for blood donation, they test him, they notify him that he has hepatitis B surface antigen positive. And what I do is I take complete history and perform physical exam. Ask about alcohol use, a family history of HBV or hepatocellular carcinoma, any signs of chronic liver disease, the ones we talked about earlier, and the investigations, of course, liver disease activity by means of liver function tests, the serologies, the viruses, HCC, we screened for that by means of checking alpha-fetoprotein. And remember this last thing, every time you have hepatitis B positive, you have to check for HCV and HIV, because people can have the triple infection all the way together. So again, this summarizes what is the diagnosis all about, namely the surface antigen as the hallmark of the infection, E antigen is signs of infectiveness, IgM, antihepatitis B core, is the marker of acute infection, etc., etc. And these are possible scenarios, like this one here. If you have surface antigen and antibody to the core, there are three possibilities. You are either acutely infected or chronically infected if your enzymes are high, or carrier if your enzymes are normal. And these other scenarios, this is an important slide. You know, you get many questions most of the time on these things here. The treatment, it used to be by interferon. Maybe you studied something in your pharmacology course, but it's not used anymore. Nowadays, we use nucleosides like lamivudine, entecavir, adefovir, tenofovir, etc., etc. And the patients respond in the majority of cases. The treatment must be prolonged for at least 1 year. And if the patient are responding, the enzymes should normalize, the surface antigen should convert to antibody, and the HBV DNA should be lower or even zero. Prevention by means of vaccination. There are 3 doses at 0, 1, and 6 months. And people who should get it, like medical students like yourself. But in Jordan, luckily, since 1996, the vaccination became compulsory. So there is no fear for you guys that you are born after 1996. So now it's the time for the hepatitis C virus, and this is a virus that has 6 different genotypes, 1 through 6. And the most important thing in this slide is this thing here, the hypervariable region. This here actually is the one thing that made it impossible to make a vaccine for hepatitis C. Okay? Incubation period in the order of 4 to 6 weeks. Not common, the acute illness, no more than 15-20% of the time, but very high the chronicity. So only 10 to 15% of patients, they don't get chronic. This is here is important. Virus C does not confer immunity, is not immunogenic, unlike hepatitis B virus, which is immunogenic and leaves the patient with lifelong immunity. So what are the extrahepatic manifestations similar to hepatitis B? Virus C can cause vasculitis, arthritis, membranous glomerulonephritis. A skin condition called porphyria cutanea tarda can be the consequence of hepatitis C infection, or the Zika syndrome, the Sjogren-like syndrome, xerostomia, etc., etc. This is the porphyria cutanea tarda with blistering, painful, itchy, blisters here. And some of them are ruptured. The serology, well, the serology, أنا بمحاضرة بخلص بعد نص ساعة. The serology is less complicated than for hepatitis B. Basically, we use the anti-hepatitis C virus antibody to diagnose acute infection. If it's negative, we go on to test for HCV RNA. And of course, the enzymes are generally elevated. but they fluctuate. Risk factors, all of these are risk factors. Being on hemodialysis, accidental injuries with needle sharps, birth from the HCV-infected mother, etc., etc. And this here is striking to note that Egypt has one of the highest prevalence rates in the whole world. Up to 20% of the population is HCV infected. We said about this. The treatment, it used to be interferon, not anymore. Nowadays, the treatment is with all oral therapy, like sofosbuvir, tenofovir, and it's effective actually in most of the patients. Over 98%, they get eradicated in 2 to 3 months. No vaccine, only precautions are effective against hepatitis C. Hepatitis D, just 2, 3, 4 slides, you know, it is an incomplete virus. It necessitates the envelope of the surface antigen. سامعين حسام الكل؟
دكتور سامع.
Okay. The viral hepatitis D is something that we don't see in this region of the world. It's more common in Italy, in some other countries of South America, but we don't see it much in here. It can be a co-infection with hepatitis B or a super infection. Same modes of transmission as for hepatitis B. The serology, it's not done routinely in many centers. Actually, even in the States, the IgM anti-hepatitis D virus, it's done only at the CDC, the Center for Disease Control in Atlanta, Georgia. So this is the typical serological course with super infection. These are the regions most commonly affected. We talked about this. And last but not least, hepatitis E. And the most important thing, it's very similar to hepatitis A, endemic in India, Mexico, and some other third world countries, and most dangerous for pregnant women, with mortality reaching up to 30% of infected people. The serology and the epidemiologic features, as you can see here. There are no vaccines for HBV or HEV, as I said. So the only ones that have vaccine are hepatitis A and hepatitis B. Just 2 words about hepatitis G. Well, hepatitis G is actually something that it's not very much talked about. It's an RNA virus. Does not cause really human disease, and that's why there's not much talk about it. Just know that there's something called hepatitis G. In this slide, I summarized the whole 9 yards, you know, everything we talked about. Like if you take hepatitis A virus, this is the test to diagnose acute infection, no chronicity. The recovered patient has IgG anti-hepatitis A virus, and the vaccinated people have anti-HAV IgG again. And for HBV, HCV, HDV, same thing. So I highly recommend to you to look carefully at this slide because it's really a nice summary of this whole lecture. Okay, so they are all RNA viruses with except the HBV. Chronicity is only with B, C, and D. And always consider alternative diagnosis. Don't walk away with this idea that anybody with jaundice or abnormal liver functions has a virus. It could be autoimmune, okay, it could be drugs, it could be even congenital things like alpha-1 antitrypsin deficiency, Wilson's, hemochromatosis, or the very common non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. All right. So we need an accurate diagnosis to manage these patients. Antiviral therapy currently is very effective against HCV, but less effective against B. It's not as common as viral hepatitis. It's 1 in a million, you know. So autoimmune hepatitis can be classified into 3 subtypes. We'll see the presentations, the management, and the prognosis. So it's a necroinflammation of the liver parenchyma, okay? And the etiology is unknown. The antibodies, they are the ANA, the asthma, anti-smooth muscle antibody, the anti-liver kidney macrosomal antigen, and the anti-soluble liver antigen. This is important, the classification. Type 1 hits most commonly young adult females. Okay, type 2 kids, and type 3 is a mix of everything that we talked about. So usually they don't have specific symptoms. They came in with fatigue, malaise, or even depression. They are young females, and on laboratory testing, in addition to elevated liver enzymes, they can have hypergammaglobulinemia, which means that they have a very high total protein while they have low albumin. So hypergammaglobulinemia is a feature, laboratory feature of acute or autoimmune hepatitis. Diagnosis is serological essentially, but liver biopsy can be required sometimes, specifically to prognosticate, to quantify the damage of the liver, to the liver. The treatment is glucocorticoids and immunosuppressive agents. So that concludes the first, lecture on hepatitis, viral and autoimmune. Any questions? Hussam?